In simplest terms, break down what augmented reality is.
Advanced augmented reality technologies combine real and unreal. So when you wear the augmented reality goggles, you're not disconnected from your real world. When I wear those goggles, I will still see all the three of you. I'll see the walls of this room, and then a digital human might be standing between Jeff and this camera in front of me. So that provides the opportunity for us to be in our real world, not be disconnected in the real world context, walk around on our own feet, see my own body, which makes it feel a lot more real. I don't see a virtual body of myself when I lift my hands. I see my real hands. I see real people around me. In that sense, it's a lot more immersive, a lot more realistic, and feels very real.
Today's episode of Minds on the Frontline explores the cutting edge of trauma recovery with returning guest Dr. Arash Javanbakht, a psychiatrist and neuroscientist at Wayne State University. Dr. Javanbakht is transforming the treatment of PTSD by integrating augmented reality therapy into clinical care. During this episode, we will explore how this groundbreaking technology helps first responders cope with trauma within a safe, controlled environment while maintaining a connection to the real world. AR enables powerful exposure therapy, training, and healing that feels genuine, because it is. This episode showcases compelling video examples of AR in action. To experience the full impact, check out the episode on YouTube. Minds on the Frontline is presented by the Frontline Strong Together 5 program, which offers 24/7 mental health and crisis support for Michigan's first responders and their families. For more information on FST5, including free access to resources and how to connect, please check out the episode description and follow us on social media. Thank you and enjoy the show.
Good morning, gentlemen.
Good morning.
Good morning.
Good morning.
Dr. Arash Javanbakht, welcome back to the Minds of the Frontline Podcast studio.
He's back.
Thanks for having me back.
This
I
is number
appreciate
4 times for you?
I think he's the most, he's had the most
Probably.
appearances.
Dr.
here.
A might.
It's going to be close.
I know. Well, they're both amazing. But for those people who didn't hear the last few episodes yet, tell everybody what you do, who you are, all that good stuff.
Thank you. I'm a psychiatrist. I'm a medical doctor trained in psychiatry. My specialty is trauma. So in my clinic, I work with all sorts of trauma-exposed people, survivors of torture, human trafficking, refugees, first responders, veterans, and I've had the pleasure of working with first responders over the past more than a decade now. And I'm also a researcher. I look at what trauma does to the brain and the body. We look at brain signatures of traumatic experiences, bodily changes from autonomic nervous system to changes in the genes. And I'm also highly involved in advancing our treatments, basically filling in the treatment gaps, specifically with the focus on first responders' needs, because this is a unique population with different types of traumas and different types of exposures and stressors. And we have some very cool technology that we'll be talking about today.
Yeah, let's get into that technology. Now, the last time you were here, you gave us a little taste of augmented reality. In simplest terms, break down what augmented reality is and differentiate it from virtual reality.
And this is a great question because there have been times that I've had a whole conversation about augmented reality or AR, and at the end people have you heard about Arash's VR work? All these technologies fall within the realm of mixed reality, which means we mix the real and unreal. So virtual reality, you wear the goggles, like the Meta headsets and all those older headsets, you wear them and then you are in a different world. So if I wear the VR headsets, I won't see any of you guys, I won't see the walls of this room, and I'm in a virtual world seeing virtual characters or things, and I'm using joysticks to basically venture around this environment, because if I stand up and I want to walk on this room, I'll fall on this table because I don't see what is around me. Now, augmented reality, the example I was use is what Tony Stark, Iron Man, was using was augmented reality. The goggles he was wearing, he would see the real world, and then digital information and objects were overlaid on the real world. Now, the dumbest version of augmented reality is Pokemon Go. Those who are familiar, you use your phone and you see what is really out there, and there's one of those creatures there, and you throw a ball and pick them. Advanced augmented reality technologies combine real and unreal. So when you wear the augmented reality goggles, you're not disconnected from your real world. When I wear those goggles, I will still see all the three of you. I'll see the walls of this room, and then a digital human might be standing between Jeff and this camera in front of me. So that provides the opportunity for us to be in our real world, not be disconnected in the real world context, walk around on our own feet, see my own body, which makes it feel a lot more real. I don't see a virtual body of myself when I lift my hands. I see my real hands. I see real people around me. In that sense, it's a lot more immersive, a lot more realistic, and feels very real, as we will talk about it later.
So why is AR better than VR for clinical therapies?
Multiple reasons. Number one is that you have to create the whole environment of context, right? So, and VR has been used because it's an older technology. AR is very new. Like the really advanced AR technology, which is Apple Vision Pro headsets, just dropped about a year ago. And because it's a more complicated technology, you have to be able to map the real world and overlay the unreal on the real. It's not like Pokemon Go. It's like has great surface mapping where if I put the virtual cop on this real desk and tables, it will stand up here. So in that sense, VR is good for when you need to create the whole environment. Let's say that for veterans, they had created VR scenarios of exposure to Iraq or Afghanistan war. So the whole environment was created, but you still are standing there using joystick. You get the dizziness, you get the headache, and because you know the environment is not real, it doesn't feel as real. With the AR, when it comes to the clinical environment, I see my therapist next to me. So there's a real human next to me. And then I see this other digital human and my brain gets confused. There are times that I really feel the confusion because I see the walls of this room. And then there is we'll see there's like a restaurant scenario where there's a bar counter. I almost leaned on this bar counter in the room because I'm standing on my feet and I see the real wall and this merges. Unreal becomes real. Then I can walk around myself on my own feet. It feels a lot more real and I can interact with these different objects in my environment. In that sense, it becomes a lot more immersive. Now, you can use it for telemedicine. You can use it for remote use. You can use it in any room and environment because it can adapt itself to the physical boundaries of that context. So all these together, I can see my social source of safety, which is my therapist. I can see my own body. I can feel that I am me and not a virtual character here. And I see the real and unreal combined in the real life context because the context is also very important. You guys know with first responders especially, the area, the place, the thing, the type of place where the thing happened is more painful. So now we can make it more contextually relevant. For all these reasons, we have found AR is a lot more immersive and feels a lot more real to people.
Yeah, the term reference frames for memory comes to mind here. Allowing you to enter a space where all these reference frames already exist. For instance, the studio is very familiar to me. Mm-hmm. So if there was something that we could achieve in the studio that would help me through clinical therapy or even performance enhancement, putting me in the scenario that I'm very used to and then adding things visually or even audibly to me seems like it's going to be more effective than putting me in a fake digital dojo, essentially, right? That's the idea.
Excellent thought that I didn't think about it this way, but this is brilliant because I know you are real. I know you.
Yeah.
I know you're real. Then this other human standing next to you will also feel real to me. I logically know, and I hear it all the time from my patients and even the colleagues who are trying the headset. I know this is not real, but I cannot feel it is not real.
And when you wear them and you're in those scenarios, and you're going to see it here in a second when we key it up, as people are walking up to you, you actually move out of the way for them.
Right.
Because just instinctively you go, oh, this person's coming at me. I need
There's
to move out of the way.
There's enough reality around them to where I'm giving them physical space.
Yes, I caught myself moving out of their way. And one time I stood still and I was waiting for them. I was waiting to feel.
You know the movie Ghost?
Yes.
Where like I feel like that. I'm like, nothing happens, but I feel like I got to brace myself.
But you know they're not real.
You're right. But you know, quote unquote. You quote unquote right? know, but your body reacts because you have enough real information around it to make it feel like there's physics to this thing.
Yes.
Scott, you feel the same when you put this thing on?
Yeah, absolutely. And it's got so many applications for treatment, therapy, training. I mean, there's just so many things you can do with it. It's made up stuff. It's cool. Yes.
Let's get into all that.
Yeah.
So Dr. Arash, you've explained this very well, but everybody's very visual. So let's walk through some of this stuff here, and you can kind of give us an overview so our listeners understand what we're looking at here.
So you're wearing the goggles. The headset basically connects to the Wi-Fi, and there's my assistant sitting in the back, EJ. He also is connected to Wi-Fi, And through the cloud, these two devices connect to each other. This means you could be anywhere in the world and I could be on the other side and we connect still with each other. Then on that computer, I see a 3D map of what's your environment, because these headsets map the surfaces. So I see where you are. I draw the lines around that environment and I said, this is our holodeck, for those who know the reference.
You gave the boundaries. This is the
Boundaries.
physical space you will occupy, computer.
Yes. And then the computer says, okay, now let's say here there's a grocery store practice, right? We want to be able to be around this grocery store. Maybe we can pause for a second to even say why we're doing this. So for a lot of our first responders with PTSD, they cannot be around humans. We can talk about it a little bit more later. So now I have first responders who have been grocery shopping online for years. Now I want to bring them here. So now you go to this grocery store that I gradually bring some people. So there's one person standing in that one corner. And as soon as you're feeling comfortable with that, one more person will come, one more person will come. And gradually we crowd this room with humans of diverse age, sex, race, behavior. And gradually it's more crowded, more overwhelming. And then you practice grocery shopping. I've had people who squeeze themselves between these characters to grab, let's say, something from the aisle. And this guy comes to you and asks you a question. He's one of the grocery store staff. So now there's some level of engagement, right?
Notice how I'm looking around him like he's physically occupying. I backed up to give him space. My brain said there's a big dude coming through.
Yes.
And then when I'm looking him in the eyes and then moving my head, the eyes are tracking me.
Absolutely.
Crazy.
Yes. This is the new feature we have added. We took a lot of programming to be able for them to look at you and look at each other to feel a lot more realistic. That experience you mentioned, all the time. Even myself, after years of having worked on this, I'm in that scenario, a human, one of those characters comes towards me, I'll walk out of the way. Or I feel the touch. If I bump into them, although they don't exist there, I feel the touch.
So I think to kind of express why augmented reality versus virtual reality, this seems, it just feels, I don't have the data on it, but it just feels more effective.
Well, it feels more real life.
Well,
right.
yeah.
That's it.
Yeah.
Like,
Right, you're not in the jungle of Zambaya or something.
Right.
Where
Playing
you're
Zelda.
Yeah, exactly. Yeah.
But it takes your environment, puts you in your environment, but with augmented reality attached onto it. You're used to that area, and you're like, this is real.
You have a
know what I mean?
shoreline to reality.
Yes.
And that allows my brain, I feel like, to accept the situation as a scenario. It's crazy.
Well, when you're in a video game or you do virtual reality, your mind knows you're not actually where you're at, right?
Absolutely.
But when you're here, you know you're in a room. Like if we were to do it in the studio, I know this I'm going to feel this table if I reach out. You know what I mean? So it adds another dimension to that.
That's why the application, there's so many applications that is. And you're using it for therapy, for treatment. You could use this for dealing with emotionally disturbed people, with irate patients like you had talked about earlier for that thing.
Just talking down somebody who's yelling at you.
Yes, you do a jump around a bridge scenario.
Or not even just calming them down, staying calm while they yell at you.
That's a good one, right?
Just chilling, be like, it's all good. Because it really, when you get into it with one of these fake robot, not real people, it does feel abrasive if you tell it to feel abrasive.
We published a paper of methods of this technology because we are the only ones in the world with this. We are the first ones. And the title of the paper is Unreal That Feels Real. The original title was The Unreal That Seems Real. But then one of my patients, police detective, she was trying to get close to these characters and she couldn't. She was like, I know they are not real, but I cannot feel they are not real. And that's the thing. You cannot feel they are not real. That's the unreal that feels real.
Yeah, there's an affective appreciation for the situation that doesn't even exist.
Yes.
That is feelings.
Yes. And then it comes to the role play aspect. Somebody said that when you role play with a human, you know what is their motive. You know they are role playing with you. It doesn't feel real. But you cannot attribute that motive to an AI character. And that's why those role plays might even feel more real.
Right.
Because it's just this random person you just met out of the 80 characters that I have that I put in front of you. And I don't know what they will say. I'm as the creator, I don't know what these characters will say to you.
Well, it's the unpredictability that you would find in real life.
Yeah.
You know, I mean, if Jeff and I are role-playing something, I kind of know how he's going to talk. I know how he's going to react. But when you're out in the field, you don't know how that person's going to talk, react, how they're going to react to what you say. So I think it does help with that. Now, we just saw the video of it. We kind of talked about it a little bit, and you've brought up this has been used a lot for people with PTSD.
Mm-hmm.
So explain how this assists people with PTSD in kind of that safe, controlled environment, and how does the AR exposure therapy work with it for treating someone with PTSD?
So one big aspect of PTSD is avoidance of anything that somehow could relate to my traumatic experience, right? For first responders and a lot of people who have been exposed to civilian sorts of traumas, the source of trauma has been humans. So humans now become a source of danger in the primitive mind. So it's hard to be around people because when you're around people, you have to constantly screen for danger. What if this or that person could be dangerous? There's a bulge here in that person's pocket. Maybe it's a weapon, this, that. And as a result, I see a lot of first responders start avoiding being around humans. For example, they cannot go to the grocery store, they can't go to a party, they can't go to a kids game, they can't go to any event, and gradually they become more and more separated. And that social isolation is actually a big part of the depression and suicide. And traditional treatments have not been able to help with that much because basically the treatments we have available are the medications that reduce the intensity of that anxiety, and then we have the psychotherapies, right? We sit and talk about it, and those help with this nightmares and flashbacks and other aspects. But that real-world dysfunction, real-world social avoidances, even work-related dysfunction, right? They don't go to work. Cops are terrified of being even at the department for their police medical, because they can't be around that work environment that the brain has associated with danger. So I could go with someone to that grocery store, and this is a police station. Yeah, we can. So I can try to go with my patient to the station and help them be gradually comfortable around that environment. But what are the chances? What are the chances we can figure that out and go there on a regular basis to help them gradually accustom and be comfortable? Or we go to that grocery store, we go to that house party, and it gets crowded, or someone or something that is triggering to them shows up, and then they freak out. And there are times that, here's the example of the house party. Let's say you are invited to a party and you're terrified to go there and be around all those strangers. So now, traditionally, we would tell patients to go do it on their own. Okay, go when there's just one person at the grocery store. Now go this time. Good luck with that. If I'm terrified of something, if I'm terrified of dogs, you can't tell me to go find a dog on the street and gradually get exposed to it. So this was a huge gap in our treatments, which was leading to significant amount of dysfunction. That's how AR helps, because I bring the grocery store, the house party, the bar, restaurant, the sports event, and the police and fire station to my clinic. Now, in that room, as you showed, I'm with the cop wearing the goggles, or firefighter, EMT wearing the goggles, and now we are at the fire station or police department roll call room. Or here we are at this house party, and gradually people come. Just one person in that far corner, and gradually, and all is controlled. I know who's coming next. Yeah. It's not unpredictable. And for patients, sometimes it takes a long time. It takes like 40 minutes until we can bring those two other characters in the room.
It would have been never if it was, let's walk into Meijer, Kroger, whatever your grocery store is around you, right? The idea seems that you're getting a lot of reps for your brain to be exposed to the situation with zero harm to you. None of these people are actually going to come after you in any way that you're actually afraid of, or that amygdala is firing, and allow you to sit in that until that thing chills out, and then you can actually go do the real thing.
Absolutely. And that the cognitive disconnect, that you logically know they are not real, but your primitive amygdala brain, the fear brain, doesn't know, helps a lot with this process of gradually exposing you to these and basically becoming more familiar and comfortable. So this is something we didn't have before. Right. And that I have had patients, some of the patients I'm treating, like for a year, they were on medications, they were doing weekly therapies, but they were still doing their grocery shopping online, not going to any family event. Now what we are doing is that, it's even funny, they come and say, hey, I'm tired of paying for online shopping, or my sister is throwing a party, can we do this? And now they're gradually going back. The most interesting example is yesterday, I had a police officer, detective, that she was terrified of going back to the station. The first time, she had a very strong reaction to being in front of the two cops. She was even like I'm worried they're going to attack me. She knew that they're not going to attack her or I'm not going to attack her, but had a breakthrough moment. Yesterday was funny. She came and she went through it and she was like, I think I'm ready to go back to work.
That's awesome.
Well, the thing about this is as the word gets out that you're doing it, the willingness for the patient to try to get better. If I have this issue and you go, okay, I'm going to take you to Meyer. I'm like, oh, no, you're not.
Yeah.
Oh, no, you're not. No, I'm not going to. There's absolutely no way you're getting me out of this house and taking me to Meyer. But this, let's try it. Just the willingness to get help is going to increase with this program.
And absolutely. And also the sense of control that they know nobody's going to enter this room without their permission.
Right.
Even if they're terrified, okay, when are you ready? Whenever you're ready, I'm here next to you. We'll walk to this character together, talk about it. Then we go to the next.
It's amazing.
Then we go to the next.
Well, I mean, another aspect of this is, obviously all the disciplines we live in a high stress environment, right? And you can't necessarily always put yourself in that high stress environment in the real world. So another kind of area that we see that the AR can be used is like the training, the preparation, almost like a performance enhancement for first responders. We can put you in those situations. And I know one that you put me in was a family member had passed away and we were role playing. The family member who passed away, their brother, sister, whatever it was angry at us that we couldn't do anything better. It was like de-escalation, trying to explain to them. And the weird part about it was I didn't feel like I was getting ramped up, right? But afterwards, you're like, I could see your body language change. And I knew this wasn't even a real situation, right?
Yes.
So how can the AR be used for frontline workers to kind of rehearse those difficult conversations or situations before they happen? Like, kind of talk about that aspect of it as well.
And how does that differ from our traditional role play or tabletop scenarios?
So what you saw was the preset scenarios, right? But we also have a scene generator. I just say that I give you a holodeck or a studio in Hollywood that I give, you have all the props and you have near 100 characters of all ages and sex and race and appearance and body type, all of those, and outfits. Now I can set this stage. Okay, let's make it look like a house. We have this this couch and this table and this and that and that. And now these characters are here. So for some of these characters, I can write what they will tell to you. So I'll have a conversation through that character with you. So the character is talking to you, but I'm talking to you. That's the one part of the training. But the more amazing part that we will see and what is your experience is the AI characters. So we have AI brains that we can put in each of these characters. You can just have a random conversation with them, like as a step up. Okay, I've been able to be around these characters in the grocery store with minimal engagement. Now I'm going to be engaged with the human, having a just normal conversation because I'm terrified of having that. But then, as you saw, you can do the role play, and they do any role play you want. De-escalation. Okay, I'm a cop. I pulled you over, and you're going to be mean to me, and you're going to give me a hard time. I'm an EMT firefighter, as you did. Your family member died, and now you're scolding me you're yelling at me because you're terrified and you're very sad, and you need to blame it on someone. And as we go, we can look at your reactions. We can measure your heart rate. You can measure your skin conductance responses, and also we can get basically, as you did yourself, both of you. You can adjust the reactions of that character. Be softer, be harder. Focus on this part of it. Be a patient of this condition. Like you can even have difficult situations. I want to practice interviewing a patient who has chest pain. I want to practice and has chest pain and is demented, cannot give me information.
And they respond appropriately. Yeah. That's the craziest part.
Let's take a look at it. Let's show an example.
Yeah.
So we recorded one of me. This is the first time that I entered the Matrix, let's say, and then I had this conversation with this AI person. Like you said, you puppeted it a little bit. You said some things that you wanted it to say, and then you let me kind of go with it. So as you can see here,
I was just working on my Mustang, and then, I don't know, time just lost all meaning, I guess.
Be more agitated during this role play. So you just asked it to get more agitated.
Wait, no. I don't need an ambulance. I'm fine. Just get out of my garage. I was fixing my car, and now you're telling me my wife called you? What's going on?
Yeah, she said you were acting weird and a little bit violent, and you seem a little aggressive today. What's going on? Now, did you see his head snap when he wanted to talk? He looked right in the eyes. It freaked me out. And the other thing I want to show you guys here is his shoulders got tense when we told him to get more agitated. He's kind of smirking a little bit, but his eyes are harder.
And here's the thing. You told him to role play as someone who is confused, and you were confused and agitated, and you were called to the scene.
Yeah.
Yeah. And look at your own reactions also. You are acting, all of us. When I'm talking, even when I was doing the video recording and I knew this is for the video demo, I couldn't hold myself, and I kept moving my head as I'm talking to them because it feels so real.
Yeah, and the other thing
hands
is
on
in
the
my
hips too.
Yeah.
Well, I do that. I do that with patients because I want them to make think I'm relaxed and chill. Once you cross your arms, you give that vibe of like I'm examining you. Like, hey man, what's going on? Try to chill out, let them see your hands. But the other thing that really sold my brain on this was not the specifics, not the beautiful rendering of this patient. I still had that baseline reality in the periphery of the real door, the real wall, mic in the background, where my brain was like, you are in the real world. This just looks like a computer guy. So let's continue a little bit here and get a little reaction.
Violent? That's not true. She's always exaggerating. I was just frustrated with this stupid engine. And now you're here and I don't know why. You can't make me go anywhere.
And so right now, right here, we're seeing EJ, who we nicknamed Tank, the guy in the Matrix who plugs in and teaches him kung fu. And this is his. This is what he sees and how to control the digital puppet, I guess you could say, and also give it parameters when the AI wants to do its thing.
Sir, I don't want to make you go anywhere. I'm here to just make sure you're okay. Do you think you're feeling poorly? Is there any problems you're experiencing today? Chest pain, difficulty breathing, nausea, vomiting, diarrhea?
No. I told you I'm fine. Stop asking me that. It's not about my body, it's my head. Just leave me alone. My wife doesn't understand me anymore. She never does. Just get out of my house.
Role play more aggressively. You are angry.
Now watch this.
Now it gets real.
Get out. Get out of my house. You have no right to be here. I don't need your help. I'm fine.
And you
Stop
backing up?
asking me questions.
I gave
Just
him space.
leave me alone.
I'm relaxing
Would
my
you mind if we
shoulders
took some vital
because I
signs?
see he's super tense. I didn't even know I was doing that, but this is stuff I do.
No, I won't
see.
let you. I won't let you touch me. This is ridiculous. I'm a paramedic too, for
And I'm
Pete's
smiling
sake.
on purpose. I'm
I
not
know
just
what I'm
smiling 'cause I'm
doing.
talking to a fake
I
guy.
know
I'm
I'm
trying to
not
like
okay.
be smiling.
And I'm
like
telling
he
you,
can
I'm
tell.
fine.
Where do you work?
Are you kidding me? I work as a firefighter, okay? I'm a first responder just like my son. Now leave us alone. We don't need your help.
This guy's, I kind of want to leave. Okay, you can,
No.
I'll be happy to leave you here.
Oh,
What if I agree with you?
fine. Get out. Get out of my house before I just get out.
Not the first time you've been kicked out of some place.
Yeah, well, that's a sign off. I don't got to transport that person.
There you
Just
go.
kidding. PD's going to transport him common ground.
Thanks. That's great. So on this, when my law enforcement brain kicks in, this for like de-escalation training, perfect example.
Perfect.
Couldn't get any better. Active shooter training. For active shooter, which is, obviously the scenario on that, the applications are just amazing what you could do with this other than treatment. I'm thinking about, like you said, make yourself better.
With no setup time either. Think about the equipment invasive, training invasive, role play invasive stuff you got to do that it consumes all the time to get an hour of training done.
Yeah.
You could hop in the Matrix and get rep after rep.
Every
after
training
rep.
corporal right now should be just like, hey,
Right.
give me this guy's phone number. I need to
I
get
know.
it up.
And you know what else is fun? If he tries to have the same conversation with this same character another time, he will say different things. It's never the same.
That's amazing.
It's like ChatGPT. When you ask it stuff, it'll give you a variation every time, almost like it's showing you personality.
Yeah.
But it's really just randomized at how it's really
Yeah.
approaching it, which makes it feel real.
Yeah.
So there's been probably some significant benefits that you've seen. You've been literally studying this.
Yeah.
So what are the most significant benefits that you've observed using AR in your work, not only for treating clinically, but beyond what you expected?
First of all, we are the only ones in the world who has this technology in our clinic, and this is for Michigan first responders. So what we are doing is, for now, we are using it for our first responders with PTSD. And sometimes, like I had an EMT who was referred to me for PTSD, and turned out her avoidances are because of social anxiety. She doesn't have PTSD, she has social anxiety disorder. And if you're in this grocery store, she's like, well, I don't want to be around these people. I was like, why? She was like, I don't care about them. And then I said, well, I see fear. And then she walks a little bit closer, and then she's like, yeah, I'm afraid. I was like, what are you afraid of? I don't know. What are you afraid of? I don't know. Well, they may judge me. Then, okay, what are they going to judge about you? What are they? I don't know. And then gradually, oh, they're going to judge me about my appearance. So anyways, that woman now is going to the sports games every week and is going to a yoga class 3 times a week. And it turned out to be a lot faster in the response. I had one of my graduate students, she had a talk at a conference and she was terrified. So we basically put humans sitting in the chairs.
Great idea.
And
what a great idea for
that's a
public
home
speaking.
run right there.
She gave her talk, and I was like typing for those, and she's a firefighter herself. And I was typing, I even put like a cop and a firefighter in the audience, and I was typing what they were saying in terms of answers, and I was making some of them frown, some of them throw their arms up, that as if they're not interested.
It's police and fire. They're probably heckling her as well.
Right. We've come a long way from imagine everybody in their underwear to be able to do this when you're
You
public
literally
speaking.
put a bunch of people in their underwear.
Yeah.
That's a different program. That's a different program.
And that one session was enough.
Isn't that amazing? They just had to like go through it to make sure their brain was like, oh, I don't die when I go here. I don't just self-emulate.
I know where we started this. I started this about 10 years ago when I would put a spider, tarantula, or dog in the environment to help with fear of spiders and dogs. Every single person in 1 hour of treatment was able to go touch a real-life tarantula. Then we were like, wow, it's amazing. Now, through this project we have here, through Frontline Strong, we got the resources to do this and create this. And now, as you said, the training. So I've had, like, other example, the cop who has been off work for a long time. Not that something bad happened at the police station, but the bad things she went through were there, like all those cases, horrible sex crime cases she was reviewing. Yeah. So now into her primitive brain, that place is associated with pain. So she couldn't even go for a police medical. So now yesterday, I put her in front of a cop who's AI character having a conversation, and you could see how in the beginning she was shy and nervous, and gradually she opened up. And now then I put a couple of other cops around and make it more look like the department, and gradually she's starting to even go back to work. So she was to the point that she couldn't even go for medical assessments to the department. Now she can go there. So I am finding more and more uses. Like,
is this the tip of the iceberg so far? Because like you don't know what you don't know yet. Like the application's got to be, I didn't think about that. I didn't think about that.
There's so many routes you can take with it.
What I know is that I didn't expect this to be so powerful. When I started this, I expected I would have to tell Jeff, hey, imagine this is real. Now I keep having to remind people, this is not real, right?
Now you're touching tables to go.
You start dreaming about the AI people because you stay there too long.
I was when we were the video recording this demo, so I was wearing the goggles and I had EJ on this side and I had Kathleen on this side and telling EJ, okay, now go to the next level, and then Kathleen maybe come to be here. So we wanted to say, okay, the therapist is in my field of view to show the visuals. At some point, I wanted to tap her on the back and say, come forward. My brain felt my hand is going to go through her. It's like, I'm like, which one is real and which one is unreal?
That's crazy.
Now, listening to this, I mean, obviously people are listening to this. They're probably a little hesitant still even to try this technology out. What would you say to them to get them to at least give it a shot?
I love that question. So there will be two kinds. One kind is like, this is just some videos. It's not going to trigger me. The answer to that is that I've never seen anyone, patient, non-patient, first responder, non-first responder, including myself, who doesn't feel this is real when you go. It's not real. The body reaction is different. I had like people sweaty, dry mouth from my experience. So that is the answer. But the other part is, I'm too scared to go do this, right? So the answer to that is, if you're 42 years old, you're not going to be 42 years old forever. The parties you're missing, the outside you're missing, the things that are limited in your life. You can go to a game, you can go to a family event, you can go to a restaurant, you can even go do your shopping that you used to love. They're like, even I've had people like they want to go to that fair or show that they like, they're terrified. And if you choose not to go, I'm absolutely fine with that, but I don't want you to be a slave to fear, and fear make that decision. So now, the biggest fear for me here is loss of opportunities, loss of your use. Most of our first responders are on the younger side, right? Like when I hit 50, I can't do the things I could do when I was 25, and I avoided. Now, let's say you come to my clinic and say, let's try it. And again, this is not a private clinic that we are looking for money, right? This is like a university clinic and everything is funded by the state. You come to my clinic and say, I want to try this. You put on the goggles and you will see whatever you are ready to see and you want to see. There's no games played, no unpredictability, no pranks. You're like, okay, I'm okay with that one person of this age, sex, race that is easiest for me to be in that one corner. And I've had patients who were first responders who were in this room for 30 minutes with 2 women talking about their kids in that corner, and they couldn't go beyond that. And we were patient with that because we are here to help you become more comfortable around these things. And the good thing is that they're fully controlled. We can, at any moment you say, I don't want to take off the goggles, or I hit pause, and everything will disappear. We leave the matrix. So there's nothing to lose. The most you may lose is that 1 hour that you will be with me, or even if you wanted to leave earlier, 30 minutes, right?
Which is just a minute portion of your entire life, right? Now, for those first responders that do want to try it, how do they get into the clinic? How do they get a hold of you? How do they try the AR?
On the FST website, fst5.org, you can find how to get referrals to our care. You can reach out to us, or you can reach out to us through the FSC, or you can just find my name and email me. You can find my email on the internet. I will connect you with our clinic, and we will do an assessment, see how this technology can help you. Because the other side also is that there are a lot of people who are doing therapy every week for years. They have less nightmares and flashbacks, but they still are not going out. They still are terrified. They may make excuses.
They're kind of coping better, but they're not. They're not thriving.
The avoidance is still there.
You're getting the surface stuff, but you're not digging down to the root cause.
I'm not sitting in my room crying all day.
Yes, but
I'm able to hang out and eat dinner with my family.
So I got that going for me.
So your real world dysfunction, which is a big part of our joy, is still there. You can go to work, you cannot be functional, you cannot go to anything that is social and public. So let's say you come and spend 10 sessions on this. Again, I'm not making money out of this. No. You come to, this is like funded by publicly funded institutions. You come here and spend 10 sessions, and now you can at least go to the grocery store. You can go to a restaurant with your family.
Go to work.
Right. Yeah. Go to work.
Yes. You know what I mean? Get back on the ambulance. Go back into the jail. You know, wherever you work or whatever you do. I mean, it's bringing you back to your old life again.
And the message of hope here is that a lot of people I've seen like, it's painful to me when I see a first responder 10 years later crying in my office because they lost a partner 10 years ago, and they've had nightmares and flashbacks and all the avoidances for 10 years, and they thought this is normal reaction that cannot be helped. We can help a ton. You don't have to live that life. You can go back and function and enjoy life because you deserve it.
Yeah, the trauma, the PTSD is not a life sentence.
Yeah,
it doesn't have to be.
No.
You know what I mean? And it's cool seeing the new technology that comes with it. That, you know, we had the old, quote unquote old, where you just go into the office, you talk. But new technology like this, why not give it a try?
Yeah,
what is there to lose?
And the best part, like you said, don't cost nothing.
Doesn't cost
nothing.
Yeah.
Well, Doc, thank you very much. Thanks for coming back again.
Thank you.
You'll be back again soon, I'm sure.
We always love having you on.
It's always a pleasure.
Yeah, and Michigan agencies, please reach out to Dr. Arash Javanbakht. Get a hold of him online.
Even departments, if they want to learn more, they can anytime come here. We give you a demonstration to your leadership, whoever wants to see it.
Yeah.
Our doors are fully open.
All right, guys. Thank you very much.
Have a good day.
Thanks.
Awesome.
Thank you for listening to the Minds on the Frontline podcast. We have more great content coming out soon. Please check us out on YouTube, Instagram, Facebook, X, and LinkedIn. And make sure to like and subscribe to all Minds on the Frontline podcast social media channels. Thank you, and have a great day.